Neomycin-Bacitracin-Poly-Hc Ointment is used to treat or prevent bacterial eye infections. It contains neomycin, bacitracin, and polymyxin, which are antibiotics that work by stopping the growth of bacteria. It also contains hydrocortisone, which is an anti-inflammatory corticosteroid that works by reducing swelling. Remember, this medication treats only bacterial eye infections, not other types of eye infections. Overuse of any antibiotic can lead to decreased effectiveness, so it's important to use as directed by your doctor. Be sure to follow the recommended dosage and apply the ointment at the optimal time as advised by your healthcare provider. When using Neomycin-Bacitracin-Poly-Hc Ointment on the eyes, it's important to follow your doctor's instructions, which usually means applying it every 3 or 4 hours. Avoid wearing contact lenses while using this medicine, and make sure to sterilize the lenses according to the manufacturer's instructions before using them again. To apply the eye ointment, wash your hands first and be careful not to touch the tube tip or let it touch your eye to avoid contamination. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Then, place a small strip of ointment into the pouch by squeezing the tube gently. Close the eye and roll the eyeball in all directions to spread the medication, and try not to blink or rub the eye. Repeat these steps for the other eye if directed. Remember to wipe the tip of the ointment tube with a clean tissue to remove excess medication before recapping it. If you are using another type of eye medication, such as drops or ointments, make sure to apply the eye drops first and wait at least 5 minutes before applying the Neomycin-Bacitracin-Poly-Hc Ointment. If using another type of eye ointment, wait at least 10 minutes after using this medication before applying it. It's important to use this medication regularly at the same times each day, even if your symptoms go away after a few days. Using it for the full prescribed time is crucial to prevent the infection from returning. If there is no improvement in your condition after 2 days of treatment, make sure to inform your doctor. After applying the ointment, you may experience stinging or burning in the eyes for a short time, or temporary blurred vision. If these effects persist or worsen, it's important to consult your doctor or pharmacist. It's essential to use this medication as prescribed by your doctor, as they have determined that the benefits outweigh the potential side effects. Although many people using this medication do not experience serious side effects, prolonged or repeated use may increase the risk of a new fungal eye infection and other eye problems such as glaucoma or cataracts. If you notice any new or worsening eye symptoms, vision problems, or eye pain, it's important to contact your doctor immediately. While a serious allergic reaction to this medication is rare, it's crucial to seek medical help if you notice any symptoms such as rash, itching or swelling of the face, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA. In Canada, you can also call your doctor for medical advice about side effects, or report side effects to Health Canada. Before using Neomycin-Bacitracin-Poly-Hc Ointment, make sure to let your doctor or pharmacist know if you are allergic to neomycin, bacitracin, polymyxin, or hydrocortisone, aminoglycoside antibiotics, or corticosteroids. Also, inform them of any other allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. If you have a history of other eye problems, such as glaucoma, make sure to inform your doctor or pharmacist before using this ointment. After applying this medication, your vision may become temporarily blurred or unstable. Avoid driving, using machinery, or engaging in activities that require clear vision until it is safe to do so. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is unclear whether this medication passes into breast milk, so consult your doctor before using it while breastfeeding. When using Neomycin-Bacitracin-Poly-Hc Ointment, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's crucial to follow their guidance to ensure the safe and effective use of this medication. If you accidentally swallow this medication, it could be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. It's important not to share this medication with others. This medication has been prescribed specifically for your current condition, so it's crucial to throw away any unused medication after treatment is completed. Do not save it for another infection unless directed by your doctor. If you are using this medication for 10 days or longer, it's recommended to have lab and/or medical tests, such as eye exams, while using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to use the ointment at the scheduled time, apply it as soon as you remember. If it's close to the time for your next dose, then skip the missed dose and continue with your regular schedule. Do not apply a double dose to make up for the missed one. When using Neomycin-Bacitracin-Poly-Hc Ointment, it is important to store it at room temperature and away from heat, but not in the bathroom. Keep it out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.